Okay. Hello, good morning. Today we will deal with the most important topic, that is international health. So nothing on earth is more international than disease. Health and disease have no political or geographical boundaries. So disease in one part of the country may spread to the other part of the country, or one part of the globe may spread to the other part of the globe. So one should be very cautious regarding the spread of the disease. So with this view, in the past several methods were adopted, out of which early detection and isolation are the early methods. So one who is diseased should be detected early and he should be isolated so that the spread can be arrested to other parts of the disease. So quarantine is one such method of controlling the spread of the disease, which was adopted for the first time in Europe in 14th century. They have adopted the quarantine, that is, for a lengthier period, they used to isolate the infected persons, particularly regarding plague. They were very much bothered. They used to detain the ships, the crews, the cargoes, the international travelers for 40 days. They used to detain the travelers. The idea behind is that with the passage of time, the disease either dies or it manifests. If it manifests, it will be treated. If it dies, the person will be disposed properly. The disease may die, the person may die. So accordingly, we have to treat, but the spread will be confined to the particular area. So this was the origin of the international health. So spread of the disease from one country to another, one nation to another nation is arrested with the quarantine. So regarding quarantine, several conferences, several agreements and cooperations between nations took place before the birth of WHO. So if you go to the history of this quarantine, the control of the diseases from one country to another country, briefly, in 14th century, the quarantine has come into force in the form of 40 days detention of the travelers and ships, crews, cargoes, etc. for 40 days regarding plague. Then came the 1851, the first international sanitary conference was held. In 1902, Pan American Sanitary Bureau was established. 1907, Office International de Hygiene Publique was established. All these organizations established to discuss about the international spread of the disease. In 1923, Health Organization of the League of Nations was held. 1943, United Nations Relief and Rehabilitation Administration was set up. In 1948, ultimately the World Health Organization was established. Now, coming to the first International Sanitary Conference, which was held in 1851 at Paris. So it was introduced to regulate the quarantine in an orderly manner and to bring about some uniformity in the quarantine regulations and rules. So which resulted in International Sanitary Code consisting of 137 articles regarding cholera, plague, yellow fever, etc. But they have not come onto the surface, never came into force. So that was a failure. All the efforts, later on, all the efforts between 1851 to 1902, more than 50 years, they have conducted several conferences, international conferences, and agreements among the different nations. But all of them, they have failed to bring about any concrete solutions. Then in America, they have established the Pan American Sanitary Bureau in 1902. So it was the world's first international health agency and to coordinate the quarantine procedures in America only. It was confined to the American continent. That is called Pan American Sanitary Bureau. Later on in 1924, they have formulated Pan American Sanitary Code consisting of different articles and regulations as concerned with the international health. 1947, the Pan American Sanitary Organization was formed after reorganization, which has served as a World Health Organization's regional office in the latter date and remained as such until 1949, and it was renamed as Pan American Health Organization in 1958. Then in 1907, Office International d'Hygiène Publique was established in Paris. It was also called as Paris Office, influenced by the Pan American Sanitary Bureau, because Americans, they formulated their own setup regarding the spread of the diseases between the states, between North America and South America. So it was created, the Office International d'Hygiène was created to disseminate the information on communicable diseases and to supervise the international quarantine measures. What were the quarantine measures taken, whether they are being taken properly or not. So in order to supervise that, this organization was set up in Paris. Later, Pan American Sanitary Bureau and Office International d'Hygiène Publique, in cooperation with 6 more countries, joined to form International Agency for Health, because all other continents were not involved. That's why they have taken initiative. So Office International d'Hygiène Publique existed up to 1950. Then its responsibilities had been taken up by the World Health Organization. In 1923, another thing that took place, the Health Organization of League of Nations took place. After the First World War, the League of Nations established the Health Organization to take steps in health matters of international concern for the prevention and control of the diseases. This Health Organization, League of Nations, did a credible work on quarantine regulations and epidemiological information regarding not only the diseases, regarding the nutrition, housing of the people in different nations, environmental sanitation, and water supplies and rural health. They have included all other aspects of which are required for the healthy living. So this health organization started weekly epidemiological reports. So way back in 1923, the organization has started weekly epidemiological reports for any disease. The epidemiological aspects will be reported weekly. All the countries will report, and it will be compiled and shared with amongst the other nations. Now the same thing is being continued, and WHO is now issuing the weekly epidemiological reports regularly. 1939, League of Nations dissolved, but Health Organization in Geneva continued to deal with the epidemiological information and used to release the weekly epidemiological reports. United Nations Relief and Rehabilitation Administration was established in 1943. These are all concerned with the international health. So, this United Nations Relief and Rehabilitation Administration was there to organize the recovery from the effects of the Second World War. The victims of the World War II in 39 to 45, they suffered a lot. So they organized the recovery process. They used to serve millions and millions of displaced persons. They have taken an outstanding work in preventing the spread of the diseases like typhus and malaria. And in 1946, United Nations Relief and Rehabilitation Administration was terminated and taken up by the WHO. So, thus the birth of the WHO is initiated much earlier, but in 1945, United Nations Conference was held at San Francisco, where Brazil and China proposed to have an international health organization. Brazil and China proposed and accepted by the other countries. So, in 1946, International Health Conference, which was held at New York, USA, to set up an interim commission for preparing the ground for the new organization. They wanted to establish a new health organization which will be helpful for the and to regulate the health conditions of the entire world. So they have presented the draft constitution which was accepted on 7th April 1948. WHO constitution had been accepted by the United Nations member states. Thus, World Health Organization represents the culmination of the efforts to establish a single worldwide international health agency. So, thus, World Health Organization was held at established at Geneva, Switzerland. So, international health regulations, we have to follow international health regulations to arrest the spread of the diseases. About 196 countries agreed to work together for health security of the world under international health regulations. All the countries need to report all sorts of health events of public health interest and impact. In 1969, international health regulations adopted six quarantine diseases, and it was revised international health regulation in 1973 and 81. And they wanted to cover only three diseases, that is yellow fever, cholera and plague. These are very dangerous diseases, so that these three quarantine diseases are of international concern. In 1995, International Health Regulation revised to address the progress regarding the international travel and trade, emergence and re-emergence of the diseases, public health risks of international concern. In 2005, once again, international health regulations were revised and they were implemented with effect from 15th June 2007. The mandates for international health regulations are detect, assess, report, and respond. We have to detect any health condition arising in a particular country. For that, we have to ensure the surveillance system, proper surveillance system must be there, and we have to ensure the quality labs which will be able to detect the public health threats, and we should be able to assess the work in collaboration in case of public health emergencies. And the same thing we have to report if there is any potential public health emergency of international concern, we have to report and immediately you have to respond. After reporting, you have to respond to the health events which have got abnormal nature, and you have to stop the events in their track before they become emergencies. After reporting, you have to act. So these are mandatory under international health regulations. You have to detect, you have to assess, and report to the international agency which is regulating the spread of the diseases, and you have to respond simultaneously with some action before it becomes an emergency. The purpose and scope of the International Health Regulation 2005. The main purpose is to prevent, protect, and control international spread of the diseases. And the second aspect is provide public health response appropriate to the public health risks and which is limited to the public health risks. Provide some response which should be very appropriate to the particular disease or health event, and to avoid any unnecessary interferences to the international travel and the trade, because by unnecessarily interfering with the international travel and trade, a lot of business will be impeded and a lot of loss will be incurred. Public health emergencies of international concern. Public health emergency of international concern. The revised international health regulation outlines assessment of the event, health event, management of the event, and information sharing for public health emergencies of international concern. We should not keep quiet if there is any new thing happens. We have to assess it properly, manage it properly within the available resources, and inform and share with the other nations and the headquarters which is responsible to control it. And we have to give notification. Each state party shall notify WHO within 24 hours about the assessment of the public health information of all events in details regarding where it has occurred, how it has occurred, when it has occurred, who are the people who are affected, what are the age groups, what are the fatality, what is the mortality rate. So how is the condition, how it is spreading to the other parts of the same nation or to other nations, and its potentiality, everything should be informed within 24 hours. So in that way, we have failed the one part of the nation, one part of the globe, recently failed to inform properly within the stipulated period regarding our coronavirus infection, so that it spread to several countries. So ultimately, the nation was blamed. So such mistakes should not occur. So when it is a mandatory to report and notify to WHO within 24 hours, that must be fulfilled. So after 2 months only, the coronavirus infection in China was revealed. By that time, it has spread to several countries and it has created a global havoc. So, four decision criteria to assess the public health events. So, first of all, whenever there is a new disease or adverse health event, you have to ask four questions. Is it potentially serious? Is it unusual or unexpected? Is it potential for international spread? Is there likely any spread among the same country and outside the country? Are there any potential restrictions for travelers? If the travelers are likely to transmit the disease, we have to restrict it. If there is any such condition, and what physical examination you have to conduct, what vaccines you have to give, what medication or prophylaxis you have to start, all these things should come into mind. So, amongst all these four criteria, at least two and four are more important. Is it usual or unexpected? If it is unusual, we have to be very cautious. And if it is having a potentiality towards having restrictions for the travelers, also we should be very cautious. So, in consultation, for everything we have to consult with the WHO in case of need. There is any need of this health event or new health event which is disturbing us, we have to consult the WHO and take assistance. WHO will definitely assess the situation with the epidemiological evidence obtained by the country, and it will verify, just like we get verification of a phone number by sending the OTP. The OTP you feed again, give the feedback, then it confirms. The service provider confirms your number. Just like that, if you consult with the WHO, it verifies and it will come to conclusion that this particular health event has occurred. Then they will ask themselves whether there is potential international spread is there or not, whether it affects the international travel and trade, then the proper measures will be offered by the WHO to mitigate the health condition. Health measures of international travelers will be suggested. Public health measures related to travelers' health under International Health Regulation 2005. So, out of all measures, the health of the travelers is more important, not only for the sake of the traveler, but for the sake of the people who are not affected, who may be susceptible to the disease the travelers are carrying. That's why international health regulations are set up. So public health measures related to the travelers are there in the form of different articles to deal with. Article 23 deals with the health measures on arrival and departure. Example, you have to give certain advices if he is going to a particular country where the particular disease is prevalent, or if the disease is prevalent here, and if you are going to a country which doesn't have the particular disease, proper restrictions, proper measures will be taken, medical examination will be conducted, a consent vaccine will be given, and informed consent will be taken before all these things. The Article 30 deals with the travelers and the public health observation. Article 31 of the International Health Regulations deal with the health measures related to entry of the travelers. Article 32, the the treatment of the travelers, how we have to treat the travelers with the respect and giving respect to his caste, creed, color, and all. We have to treat the travelers very courteously, and we have to take the preventive measures regarding any health condition. Article 36 deals with the certificate of vaccination with regard to specific disease. Suppose a specific disease is not there in our country, if somebody is coming with, from a region where the disease is more prevalent. For example, yellow fever is not there in India, but it is present in South Africa. Anybody coming from the endemic region of yellow fever, he should have taken the vaccination uh, and he must have spent the period required. Then only the certificate will be valid and India allows. India is very particular about the yellow fever vaccination from the countries where it is endemic. So regarding the travel notices also, one should be very cautious. Before traveling, there are certain notices which the service providers will give, and action should be taken by the traveler and risks should be known. Suppose notice level 1, service provider will watch. Action taken should be taken by the travelers to follow the precautions for a particular destination. If you are going to a particular country, particular continent, very particular uh, problem is there, they will caution. You have to watch it carefully and certain precautions must be taken. That is the risk level 1. Its usual baseline risk will be there. That you have to take it care of. And in level 2 notice, they will alert you to follow enhanced precautions. Some more precautions you have to take when you are going to a particular destination where some particular health problem is there. That is, there is an increased risk is there, so you may delay the travel. So the third level, they will give a warning to avoid all non-essential travel to the destination. That is, level 3 is high risk to the travelers. So with this international health introduction, I'm going to complete. Next time we will deal further with the international health agencies. So this is the United Nations emblem. Thank you very much.